There are about 40 licensed facial plastic surgeons in the state of Connecticut. Dr. Aaron Mercer was considered one of the best. He sent us this recording 3 weeks ago. He has not responded to follow-up since. The photograph was in a patient file from 2019. The woman in it had my patient's cheekbones, not similar, not reminiscent, the exact same geometry, same orbital distance, same mandibular angle, same small asymmetry above the left brow that I had spent 40 minutes correcting in surgery. The woman in the photograph had been dead for 11 years. My name is Aaron Mercer. I am 61 years old. I completed my residency at Yale New Haven Hospital, practiced for 23 years at a private clinic in Westport, and I am telling you that because my professional memory is, or was, precise. I have reconstructed faces after accidents, after fire, after assault. I do not misread measurements. I do not confuse patients. I am telling you this so you understand what it means when I say, I do not know how to explain what I found. I should also say, and I'll only say this once, I haven't slept well since March. My memory of the sequence of events may not be perfect, but the photographs are real. I have them. Facial reconstruction is geometry. You are measuring distances, the interpupillary span, the nasolabial angle, the ratio of upper to lower facial thirds. These numbers do not lie. A face is a set of coordinates. My job is to move those coordinates closer to something the patient finds acceptable. The clinic was quiet in the evenings. I often stayed late reviewing files. There was a coffee machine in the hallway outside my office that made a specific clicking sound every 40 minutes when it cycled through its cleaning program. I know that sound well. I heard it 17 times the night I found the photograph. It started with a complaint I had heard before. A patient, I'll call her patient F, came in for her 6-week post-op review, rhinoplasty and minor orbital work. The results were measurably correct. Her outcome photographs matched the surgical plan within acceptable deviation. She sat across from me and said she was having trouble with mirrors. "It's my face," she said. "I know it's my face, but something is wrong with the distance between my eyes. Not wrong, but it's not my distance." I explained post-operative dysmorphia. It is a documented phenomenon. I have seen it before. I recommended a therapist I work with regularly. I made a note in her file. I did not think about it again for 3 weeks. Then patient D said the same thing. Different surgery, jawline reduction, brow lift, different demographics, different history, different face. He came in at his 8-week review and said, "I look at myself and I know it's me, but the spacing feels like someone else's spacing, like the eyes were placed by somebody who made different choices." I wrote interpupillary perception variance in his chart. I looked it up later that night. There is no clinical literature for it. I had invented a term for something I didn't understand. I pulled the files on 5 other patients from the previous 14 months. Patients who had completed their post-op reviews without reported complications. 3 of them had noted something similar in their follow-up questionnaires. I had read those questionnaires. I had marked the relevant boxes, patient adjusted well. I had moved on. I read the language again. One patient had written, "I dream about places I've never been. I don't know if that's normal." I had not flagged that. I want to be clear about this part. I made a decision that I understood at the time was irregular. I pulled the physical archive, not the digital files, the actual printed files from before we converted the system in 2021, preoperative photographs. My preoperative photograph documentation is extensive. I photographed patients from 11 angles before any procedure. I told myself I was looking for a surgical pattern, an unconscious bias in my results. Some template I had been defaulting to without awareness. I knew that was not entirely why I was looking. I stayed in the archive room until 11:40. The coffee machine clicked twice. The preoperative photographs were not what I found. In the back of the 2018 physical archive, there was a folder I did not recognize. No patient number, no intake date. Just a rubber band and 7 photographs printed on standard paper, slightly faded. They were not my photographs. I did not take them. The angle was wrong, not my documentation protocol. And the subjects were not posed for medical photography. They looked like photographs taken without awareness. Someone at a table, someone at a bus stop, someone walking. I did not recognize any of the faces at first. I sat down. I looked at the third photograph for approximately 4 minutes before I understood why it was familiar. The nose was mine, not similar. Mine. The exact bridge angle. The precise width at the LR base that I had corrected in a patient in March of 2021. I have a photograph of that patient's post-operative result framed on my own wall as a reference case. The person in the photograph was not my patient. The person in the photograph was wearing clothes from a different decade. I did not sleep that night. I am not being dramatic. I have the records. I pulled my own smartwatch data, and my average heart rate between midnight and 6 a.m. was 94 beats per minute. I lay in bed and I was doing math in my head, and the math kept coming out wrong. The next morning, I cross-referenced the remaining photographs against my post-operative files. I was methodical. I was clinical. I was trying to be the version of myself who reads measurements and does not reach conclusions without data. By 9:15 a.m. I had matched 4 of the 7 photographs to faces I had produced. Not faces I had started with. Faces I had created. Results. The photographs were taken before I performed the surgeries. I called my office manager, Denise. She has been with the clinic for 14 years. I asked her if she had ever seen the folder. She was quiet for a moment. Then she said, "The thin one? With the rubber band?" I said yes. She said, "I thought it was yours. It was in your handwriting." I told her my handwriting was not on anything in that folder. She said, "Aaron, your name was on the outside of the folder." I drove to the clinic. I looked at the folder. She was right. My name was on it, in my handwriting. I have never written on that folder. I want to pause here. Dr. Mercer sent us the folder. We had the handwriting analyzed by a forensic document examiner at the University of New Hampshire. Her conclusion was that the handwriting is consistent with Dr. Mercer's known samples. She also noted the ink oxidation suggested the label was written approximately 15 to 20 years ago. Dr. Mercer has practiced for 23 years. We're going back to his recording now. There was a final patient. She came in on a Thursday in late February. She had been referred by a colleague. Blepharoplasty consultation, eyelid correction, straightforward. I took the preoperative photographs, standard protocol, 11 angles. She was pleasant. She answered my intake questions correctly. She asked reasonable questions about recovery time. I had no reason to note anything unusual. She left. I transferred the photographs to the digital file. I looked at the first photograph, and then I stopped. My hand was on the mouse. I couldn't move it. I made a sound. I don't know what kind of sound. Her face, in that photograph, the measurements. I had the archive folder open on my desk from the previous week, the 7 photographs. I had not put them away. The 7th photograph. I picked it up. I held it next to the monitor. The interpupillary distance, the nasolabial angle. The small asymmetry. She hadn't had surgery yet, and the seventh photograph was already her face. I called the referring physician. He had no record of sending her. Her intake form listed a phone number. The number belongs to a storage facility in Bridgeport that has been closed since 2017. Her name is not unusual. I searched it. There is a woman with that name in the Connecticut Vital Records database. She died in 2009. I have not performed the surgery. I don't intend to. But she left something at the consultation, a small photograph. I found it tucked under the paper on the examination table, a photograph of herself. Preoperative, clearly. The asymmetry above the left brow is still there. On the back, in handwriting I don't recognize. Please, fix it back. That was 6 weeks ago. My upcoming appointment calendar was fully booked yesterday morning. I didn't book those appointments. Dr. Mercer sent us scans of the 7 photographs and the intake form. We showed the photographs to a facial recognition researcher at a private firm who asked not to be named. She compared them against public obituary archives from 7 states. She matched 6 of the 7. She said she stopped at 6. She didn't explain why. She asked us before she hung up whether anyone on our team had recently had any cosmetic procedures done. We told her no. She said, "Okay." She didn't sound like she believed us.